this hurt the most, but you pulled all of this. So you said to me it'll take 6 or 7 times and
Actually,
it'll
it didn't
be over
take that many, did it?
I
think we had 5.
Yeah, I was going to say 4, and then I came back for a tweak.
Yeah.
And I'm 100%, and there was no surgery, there were no needles, there was.
Yeah.
So to me, it was a miracle, because I thought I was in for the long haul with the needles and the thing and maybe the surgery and the laparoscopy.
And the treatment was comfortable.
The treatment's great. Are you kidding me? You lay down on the table and there's music playing, and Ed will talk to you if you want, and he doesn't if you don't want. And
Okay.
and I remember one time I was laying there and I went, because I woke myself up. It's great. And the thing that of course was encouraging to me is that I'm at an age as a baby boomer where I have aches and pains that I never had before, and I have so many friends who do. I have a friend with serious migraine headaches that she's suffered with her whole life. I have people I know with carpal tunnel syndrome, and we started talking about that, and to my astonishment, Ed said, those are all muscle injuries. Even the migraine headaches, you said, are muscle.
Headaches are vascular. And when muscles contract tightly, they stop the blood supply to certain areas of the head. They compress nerve tissue. The combination creates awesome headaches in many people.
But you explained to me that literally a series of, somewhere you said between 5 and 8 treatments, for the most part, people who've had migraines maybe for decades, he says, walk out of there at the end of those maybe 8 treatments and never have a migraine again for their whole life?
Perhaps saying never would be overstating it.
Okay.
Even at worst, it would be managing the headache.
Wow.
Within 3 to 5 treatments, most chronic headache patients no longer have the headache.
Carpal tunnel syndrome, which is a muscular thing?
To give you an example, when we contracted with General Electric for their appliance division, they had a oodle of carpal tunnel based on the type of work. These were assembly workers with appliances, repetitive motion. And out of the 230 some odd employees that came through with carpal tunnel, only 1 went to surgery. The rest continued doing the job and still got better. That was a big plus.
Yes.
One of the things that I found interesting when I had the treatment is that you were explaining to me the machine not only sends whatever electrical impulse is putting things back where they ought to be, but you said it is measuring the depth?
What it measures is called the bioimpedance. And from that measure, it controls both the current, the voltage, and frequency.
Which means it's instantaneously and constantly reading. What's impedance?
It's finding
what
what's wrong. Impedance is how current would flow or not flow through a tissue medium.
But as you're moving that I call it the cylinder,
Sure.
if you will, over my leg as you did, does that mean then that cylinder is constantly reading virtually every split second?
Every 2.5 thousandths of a second, it updates itself. Now the amazing thing is, this gets kind of interesting here. This cause of ion exchange won the Nobel Prize in Medicine in 1991.
Now that's
so
really
we can't
amazing.
be all that wrong.
No.
But if it won the Nobel Prize, and the other thing that Tina, I was very interested in, because, well, I mean, after all, this is what you do for a living, so you're very concerned, aren't you, about how people care for their body, but you don't want to do anything reckless.
No.
And when Ed said to me, this has been FDA approved since when?
87.
Yeah, so
Excuse
it's FDA
me,
approved.
78.
78.
Yeah.
So it's FDA approved. So you already know you're working with something that the FDA says is okay to do. So I'm just dazzled by it, and I want everybody to experience it, because pain is such a debilitating thing. And it seems to me that in trying ABT, as was the case for me, you have nothing to lose except the pain.
Right.
and maybe a little bit of time. It's not going to hurt you. You're not taking a lot of drugs. You're not getting cut. You're not looking at rehab time. You're not. It's what have you got to lose but the pain? The worst thing that would happen is it wouldn't work, and that doesn't seem to be your history at all. It always seems to work.
Very small percentage. Very small.
Does not work.
Does not.
But the rest do.
90% plus, we get tremendous results, and we get them very quickly. So they're not investing much time. If you look at the history of the patient, as they come in the door and talk to us about what they've done or what they haven't done, what they've tried, what they've not tried, this is quick. This is very quick.
Well, you're talking 6 to 8 weeks. We have
Oh,
maternity
no.
leave for 6 to 8 weeks, even, and that's so minimal.
Not 6
you
to
know?
8 weeks. No.
Treatments.
Treatments.
6 to 8 treatments.
Yes.
6 to 8
Yes.
treatments, and
Yes.
and
That can be accomplished in 3 weeks.
Well, if they come in twice a week, yeah.
Yes.
Exactly. But I'm just saying, putting this in perspective, a recovery time with someone which mandatory maternity leave is 6 to 8 weeks. You look at that time frame, and if someone can get actually feeling better in a shorter amount of time, I don't want to say pain-free, but actually it is pain-free, and to get rid of the symptoms, then we also have, a win-win situation right there.
And it
with
does
both.
have, it's relatively fast. You're absolutely right.
Right.
In the overall scheme of things, my goodness, if you were to have a surgery and then have to go into recovery.
Well, had they performed a surgery on your knee,
I
you
was
would
so
have been minimum of 8 weeks
and
in
and
recovery.
I saw that as if that had happened, I was afraid that was kind of the beginning of the end of my mobility as I enjoy it, because I know a lot of people. I know
that-
dancers who have had things done, and it,
Yeah, your
So
quality
this
of life.
sometimes is a wonderful substitute for other therapies
Okay.
because it's very quick, and if they fall into the category that we specialize in, this myofascial pain.
what's
it-
myofascial mean?
That is a muscle injury that has a fascia component. Fascia coats all the muscle fibers of the body.
So it's a muscle injury
It's a muscle injury.
that has affected the coating of the muscle.
Yes, the fascia.
You see, you could have said that instead of myofascial, which made me think, I
But
don't
I
know
have to
what
use
he's
the right.
talking
I have
about.
to use the right terms.
Yeah, exactly. We did go into that in his
Yes.
last interview. So that was really good.
I did see that, yes. I could have taken my notes from that one.
Well, that's the medical terminology for the type of injury. And frankly, muscle injury leads all in the category of pain. There's a muscle component to virtually every injury that's ever come through our door. And often it's the only part that needs to be fixed. The chiropractor has done his work, but if the pain persists after these other therapies, these are the people that should pick up the phone and call us. I had the opportunity to steer Nancy in.
Yes.
She wasn't going to come.
Yeah.
She had
I was on my way to the other
I said,
doctor.
"Well, this
Yeah.
is divine providence. You need to pay attention.
You did, and
Come
I'm so
here
glad I
and
listened.
try this because
Yeah.
you're going to be amazed." Well, certain skepticism, and I don't blame that.
Well, but the wonderful thing, Tina, and I know that, of course, you've talked with Ed a great deal, the wonderful thing in the consultation that you did beforehand is that any skepticism I had was gone.
Okay.
Because naturally, I was just concerned that, are you going to do something that could hurt me? I mean, could this make it worse?
Right.
What's the downside here? And literally, you explained that the downside is that maybe
It may
it
not
won't
work.
work.
Right.
There is no other downside. So to me, that's kind of a no-brainer. I hurt. It's most likely going to work. There's absolutely no downside. Sign me up.
Perfect scenario.
Yeah.
Yeah. And that's so fantastic because I hate to think of what the alternative would have been, especially with your quality of life and how busy you are. And to have a knee injury, it's devastating for the rest of your life.
Well, it is for people, isn't it? And they have surgeries. My husband had 2 knees replaced. He ended up, because of a very arthritic family, walking bone on bone. Now, it's likely that he still needed to have those knees replaced because he was bone on
But
bone.
recovery
the
time.
recovery could have been, as I look back on it, it could have been so much because he had both knees done at the same time. And bless his heart, he paid for it. He
It's
really
a struggle
paid
to come
for it.
back. And
Yeah,
the older
it
we are,
was.
the harder it is.
Yeah.
So if you're 30 years old and have that happen compared to 60, big difference. Recovery time is horrible.
One of the things that Ed did recently, and this seems so dumb, but when I went down the stairs, so that I didn't fall, I jammed into the wall so much so that I went like this, and I peeled all these fingernails back. I jammed in so hard. Well, all of a sudden, this finger has this knuckle swollen and it hurts in here. And Ed said, oh, sure, you did something to your muscle there too. So he grabs the little magic wand and it doesn't make a noise. I'm just making a noise. Did this. It doesn't do that. It doesn't go, that's Nancy sound effects. And you did this and you did this. And I went home.